Can a revision be done on autoplasty performed 15 years ago? Had, from what the one pic will show, is presumably a botched autoplasty 16 years ago. I have this excessive tissue in my left ear that my right doesn't have. Now that I'm older and more financially secure, I'm looking at a revision or perhaps just excising the skin. Could there be sutures still in place that are too secure to be causing this fold in my ear? Professional advice and recommendations, please.
Thank you for your question. In your question, you submit a photo of your ear and you are asking, can revision surgery be done for what you perceived was a botched otoplasty 15 or 16 years ago? So with the photo you submitted, certainly it is helpful, and in the absence of physical examination, I can at least give you some perspective, and perhaps the term botched is a little too strong to describe your previous surgery. To give you a little bit of background, I'm a board-certified cosmetic surgeon. Otoplasty is a procedure we perform in our practice, and I can certainly give you my perspective based on some anatomic principles which can help you probably understand what the mindset is in choosing procedures to help people with prominent ears. So to begin with, let's start with terminology. The first issue, and the area where you see the quote excess tissue, is in the central part of the ear, and this is called the conchal bowl. And the term for prominent ears that are related to this width or increased protuberance of the conchal bowl is called conchal bowl hypertrophy. Now that area, in my practice, what we do is we resect or remove the cartilage and then reattach the cartilage to the side of the scalp in an area called the mastoid fascia. Now, I feel that that's more anatomic in comparison to other procedures that are sometimes offered, particularly for patients whose cartilage is soft, and that procedure is called a setback procedure. And I have a suspicion that this might be what you had done, where sutures were used to pull the ear back into position. But because the cartilage has a lot of memory and it's kind of brittle, it can break and create this type of potential irregularity. Again, I wasn't there for the original surgery. I can't say exactly. A physical exam is also helpful. You can feel what the cartilage feels like. But if you are bothered by that, then that's something that can be addressed. Just for completion, there's also an upper part of the ear which is referred to as the antihelical fold. And what is commonly an issue for people with prominent ears is absence or lack of development of the antihelical fold. And for that, there are procedures called, particularly one called the Mustardi procedure, where sutures are placed in a certain way after the cartilage is weakened to try to recreate an anatomic fold. So I think that your next step is to meet with doctors who perform otoplasty. It's a very interesting procedure that can certainly be dramatic in the improvement. But if you want to do both ears, or if that one ear is the one that bothers you, you always have to measure and see, compared to the other ear is projected away from the skin. There are a lot of nuances that can't all be addressed with just a single photo from one angle. But I think to help you at least have some hope, it's likely, based on the photo you submitted, that some type of revision surgery is possible. So I hope that was helpful. I wish you the best of luck. Thank you for your question.